Okay, folks, many of us know that what we eat affects our overall health, right? But did you know it can also impact your skin? This is very interesting. Dr. Gregory Delost is here from Optima Dermatology, here to break it all down. And this is great because you always talk about your skin, you're thinking about lotions, staying out of the sun, light, and all that kind of stuff, but it has a lot to do with what you eat, I guess.
It is really true. We are what we eat, and then sometimes the skin shows that.
Okay, so we're talking about a couple different ways to go here. High glycemic, what does that mean?
So glycemic index is it's a rating of how quickly a food that you eat raises your glucose levels.
That'd be like sugar.
Yeah, your sugar, your blood sugar. When you eat foods with high glycemic index raises your glucose, raises insulin, and can cause different issues. And we think that a lot of those sugar spikes are linked to acne, actually.
Oh, okay. So like the more like candy bars, candy, sugar-coated cereals, and that sort of thing, and you're a kid, you're likely that's going to make your acne be worse than it is.
Yeah, not only for acne, but just overall health, like things like diabetes down the line too.
Okay, well, let's roll over to the Mediterranean diet because everyone's talking about that. We just had a heart doctor mentioning that right now.
Absolutely.
So they worry about it for your heart and inside you. How does it affect your skin?
The Mediterranean diet is really getting some traction in the dermatology world. Mainly, they're doing some studies with psoriasis and eczema patients, and they find that the Mediterranean diet is very anti-inflammatory and could be beneficial for people with chronic inflammatory skin conditions like psoriasis.
Okay, so we're at a very dry time of year right now. You know, it's like everyone's dried out, right? They come to see you and say, use more lotion, use more lotion. So we talk about these different foods. Are there more foods you should eat to help improve your situation right now?
Not only sticking to lower glycemic index foods, but making sure you're properly hydrated this time of year is very important too.
Hey, so we talked about glycemic. What kind of foods we put in that group?
It comes down to foods that take a longer time to increase your blood glucose levels. So like whole wheat, multi-grain type foods like that. Avoiding any of those like processed sugary foods.
So as we try to treat ourselves from the inside out, are there supplements that can help you too?
There are some supplements out there. So if we talk about acne specifically, there's two emerging ones that could be helpful. One is pumpkin seed oil. We find that has an antioxidant property and can also help skin turnover. And then there's another one called NAC or N-acetylcysteine, which is another antioxidant that could be helpful for acne.
Okay, so we're working on the acne a little bit. How about some other skin? What's another skin condition that is prevalent right now? Somebody comes to see you and it's like, yep, that's what you got.
Well, another really common thing we see is venous stasis or having fluid overload in the legs, usually from poor circulation, and that could lead to different things like venous ulcers and complications. So there's an emerging supplement called diosmin that could be helpful for that.
What does diosmin do? How does that work?
We think that it could actually help improve venous tone, so it could actually help pump the fluid in the blood back to the heart a little more efficiently.
I tell you, I've got this piece of paper in my hand with all this information on it, and I'm thinking about, I don't do this very often, folding it up and putting it in my pocket.
Yeah.
Because there's some really good stuff on here. So we're talking about a lot of stuff you can go to the drugstore and you can actually buy over the counter.
These are over-the-counter supplements that you could get. But I would also say that before you start getting into these supplements, you want to talk to your doctor about it too and make sure it's a safe option.
Take some guidance.
Yeah, take some guidance there.
Because there's a lot of commercials out there that tell you, you know, the sun is blue and, you know.
Yeah, be careful what you read. But
yeah.
Another good one that we were just talking about for skin cancer prevention, nicotinamide. It's something that I often recommend to my patients that have a history of multiple skin cancer. So nicotinamide it's a derivative of vitamin B3, and there are some big studies in Australia, which is really like the skin cancer heart of the world, where they do all this research, and they find that doing daily nicotinamide could help prevent more skin cancers because we think it could help with DNA repair.
Because where they live, they're getting that direct sunlight.
Right on the equator there.
So the sun is closer to the earth there than anywhere else.
And it's more of like a direct perpendicular hit that you could get there.
Yeah, that's why we wear those hats with all the bells on.
Absolutely.
Hey, so did we talk about diosmin already? Can we talk about that one again? Because how's that different from the last one we spoke about?
So the diosmin is really helpful for more like venous stasis and swelling in the legs.
And
then bromeline's another good one. So bromeline's actually derived from pineapple, and bromelain can be very helpful for bruising, and you could get that topically over the counter.
Yeah, so I would take note of all these things that the doctor mentioned, because these are things that you hear about that you can take. You know, we've learned from the other doctor, you are what you eat.
Absolutely.
And this takes it one step. Yeah, it makes it one step better. Thank you very much, man.
Thank you.
Always good to see you.
Nice to see you.
Keep that skin fancy, right?